Well, thank you for joining us for another Alcoholism Today educational presentation. Today, we're going to be talking about alcoholism as a family disease and the effects of codependency. Alcoholism, or AUD as it's referred to medically, isn't just an individual condition. It often affects the entire family system in deep, lasting ways. And that's why it is frequently described as a family disease, reflecting its broad impact on relationships and household functioning. Alongside it, patterns of codependency can develop, where family members adapt in ways that may unintentionally sustain harmful cycles. Within families, IUD can lead to, first of all, role shifts. Children or partners may take on responsibilities beyond their age or role, becoming, let's say, a caretaker or a peacemaker. Research on children and families affected by substance abuse highlights increased caregiving roles and disrupted development. Again, AUD can lead to emotional strain. Anxiety, anger, guilt, and confusion are commonly reported in families affected by alcohol misuse. Communication breakdowns, avoidance, secrecy, and conflicts often replace open dialogue in households affected by AUD. And intergenerational effects. Children raised in these environments have an increased risk of developing substance abuse issues or relationships difficulty later in life. Family members often adjust their behaviors to cope with instability, which is understandable. But these adaptations can sometimes unintentionally reinforce the cycle of alcohol misuse. Now, what about codependency? Codependency refers to a behavioral pattern where someone becomes excessively focused on another person's needs, often at the expense of their own well-being. While not a formal clinical diagnosis, it is widely discussed in clinical and support contexts related to addiction recovery. Common signs of codependency include, first, difficulty setting boundaries. Second, feeling responsible for another person's behavior or for their recovery. Third, enabling behaviors, covering up consequences, making excuses. Four, low self-esteem tied to helping or fixing others. And five, fear of conflict or abandonment. In the context of alcoholism, a partner or family member may attempt to manage or control drinking through checking, rescuing, and compensating behaviors. These responses are often rooted in care, and distress can unintentionally reduce consequences that might otherwise encourage change. And briefly, how do alcoholism and codependency interact? The relationship can become cyclical. First, the person with IUD drinks. Second, family members react, worry, control, rescue. Third, short-term stability is restored. Four, underlying issues remain. And finally, the cycle repeats itself. This dynamic is widely described in addiction science as a reinforcement loop in family systems where behavioral patterns unintentionally maintain the status quo. Importantly, this does not mean family members cause alcoholism or AUD. AUD is a medical condition influenced by genetic, psychological, and environmental factors. The family members are not to blame. Thank you for joining us for this educational presentation. And to learn more about alcoholism, please visit our website, alcoholismtoday.org. Thank you.